Hi, my name is Dr. Naresh Kumar Bhutan. I'm a consultant general adult psychiatrist, and I'm going to talk to you about OCD, or also known as Obsessive Compulsive Disorder. Before I talk about Obsessive Compulsive Disorder, it is important to know that this is a type of anxiety disorder. When we talk about anxiety, anxiety can be normal, it can be abnormal. Normal anxiety or stress helps us perform better. It takes us out of our comfort zone to get motivated and get focused on the task, such as while preparing for the exams, job interviews, or even going for a date. But if it is too much or for too long, then it starts having negative effect. We start feeling fatigued, we feel exhausted, we feel that stress is overloaded, we feel panicky, anxiety, and anger creeps in. And then eventually it leads to burnout and breakdown. So, obsessive compulsive disorder is similar. And similarly, with the anxiety, it can be a part of the state in a particular time frame, or it could be a trait of a person. Now, in the OCD is a chronic condition with obsessions and or compulsions which cause severe distress. What are obsessions? Obsessions are own, irrational, repetitive, intrusive thoughts, impulses, or images which cause distress. I'll explain this, which means that they are irrational. That person retains the insight that they should not be getting these thoughts, impulses, or images, and they are repetitive. They keep happening again and again, and they are intrusive. It means that even if you're doing something unrelated to that particular obsession, this keeps coming back in like an intruder, and hence it causes the distress. Now, to overcome that, sometimes people indulge in compulsions. These are again similar way, their own irrational, repetitive thoughts or acts to neutralize the distress caused by obsession. Symptoms should last at least for 2 weeks to be diagnosed for OCD, and on most of the days. There are various types of obsessions and compulsions, the common one being of checking, washing, contamination, doubting, counting, and aggressive impulses. Starts early in life sometimes between the age of 10 to 14, and again it can peak up in their 20s. It doesn't differentiate between the genders, so men and women are affected equally. It's quite common disorder, affecting nearly 0.5 to 2% of the population, and sometimes it can start quite suddenly and it has a fluctuating course or a chronic course. In terms of the outcome with the treatment, 20 to 30% show significant improvement, 40 to 50% show moderate improvement, while 20 to 40% can be suffering with chronic or worsening of obsessive compulsive disorder. It's commonly associated with other disorders such as anancastic or obsessive compulsive personality traits in conditions like schizophrenia, another neurological condition such as pseudonym-chorea, which affects the basal ganglia in the brain, and in children particularly, it can be associated with a syndrome called PANDAS, PANDAS, which stands for pediatric autoimmune neurological disorder associated with streptococcal infection. That means a child may be affected by a streptococcal infection such as throat or kidney infection, and then they develop obsessive compulsive disorder. But once their streptococcal infection is treated, the OCD symptoms may remit without needing any further intervention. Similarly, we need to differentiate obsessive compulsive disorder from other conditions, such as having normal worries. Now, you may be thinking about your job, your stress at work, whether you have closed your laptop properly or not, you shut it off. If not, then there's a data breach possibility, and you may like to check it again. But sometimes it can be quite a significant one, leading to obsessive compulsive behaviors. Similarly, people who are quite perfectionist, they tend to repeat certain behaviors. People who suffer with schizophrenia can also have obsessive compulsive symptoms associated with their condition. Certain phobias may be associated with obsessive compulsive symptoms as well. Similarly, it is commonly seen in other conditions such as depression or hypochondriasis, that is a fear of having uncured, untreated, undiagnosed condition which has got a fatal outcome. So, among the other conditions which are commonly associated with obsessive compulsive disorders are such as body dysmorphobia disorder, where the person believes a part of their body is misshapen or is deranged or not functioning properly. They may also have condition known as trichotillomania, which is hair pulling, that they pull out their hair unknowingly sometimes, to the extent that they lose hair in certain parts of their body, such as hair on the head particularly, leading to baldness. Hoarding or collection, people start believing that there's certain items of value to them, but they are not, and they just keep collecting it to the detriment of their own environment and self. And similarly, gambling. where people indulge in gambling or internet gaming sometimes as well. And these are being collectively put together as obsessive compulsive related disorder. Problem with obsessive compulsive disorder is that it doesn't happen just alone. It brings in other sets of conditions as well. Depression is commonly seen. In such people, people may like to self medicate by using drugs and alcohol. They may also develop social anxiety and social phobia. And from time to time, they may also suffer with panic attacks or panic disorder. And also associated with it is the eating disorders. People sometimes can indulge in bulimic behaviors, binge eating patterns, or even anorexia nervosa. Neurological conditions which can occur with obsessive compulsive disorder are mostly in the form of Tourette disorder or tic disorder, where with children or young adolescents they may develop with certain motor tics or motor or verbal tics. And complex tics is known as Tourette disorder. How do we treat obsessive compulsive disorder? After doing the proper assessment, applying validated rating scales to measure the severity of obsessive compulsive symptoms, ruling out any other comorbid conditions, we'll talk about the treatment plan, which will include primarily multi-pronged approach, which is looking at the medications as well as the therapy. The therapy is in the form of cognitive behavior therapy, and the commonly used cognitive behavior therapy technique is called exposure response prevention. It means person is exposed to these obsessive thoughts or behaviors, but they are prevented from acting on or carrying out the compulsive acts. The idea is that once they have learned to control their anxiety, the anxiety will peak up on being exposed to the obsessive trigger, but then over a period of time it will die out, and that will reinforce controlling your compulsions initially and then obsessions. The medications that we use commonly are first step approach in the use of selective serotonin reuptake inhibitors such as fluoxetine, citalopram, sertraline, and sometimes even the higher dosages may be required and longer duration of treatment is required to control the symptoms. If these medications fail, then of course we have step 2 medication called clomipramine, which is again a tricyclic antidepressant with more serotonergic activity. People have also used, if these medications have not worked, then they may combine the medications, both of these medications, or they may add other medications such as antipsychotics and sometimes combining with other treatments. Now, very rarely, when somebody develops quite significant suicidal ideation with obsessive compulsive disorder, they may require admission in such cases in the hospital, and that may also need to be treated with ECT, electroconvulsive therapy. Now, various other treatments which are available only in specialized center in the tertiary care normally include psychosurgery and sometimes deep brain stimulation, which is insertion of electrodes in the brain and stimulating them, and also using other novel or experimental treatments such as using transcranial magnetic stimulation or transcranial direct stimulation, or even trials about certain magic mushrooms such as psilocybin is being carried out. We don't know the full long-term effect of such treatment yet, and hence they are still experimental and available only in very few centers around the world. In terms of the recovery from the OCD, it's quite good if it is identified in early stages and treatment is instituted at a very early stage. The condition of improvement is also reliant on the continuation of the treatment. Just because people start feeling better after initial phase of the treatment, they stop the treatment and hence start having relapses. Persons should continue the treatment as per the medical advice, and they should continue it as long as it is required or recommended. For further information, you can always contact my clinic, and thanks for watching this video.